Hello everyone, my name is Nadia Jones and I am a nursing student at Indiana State University in the LPN to BSN program. This health education program is for Nursing 444 Community Health. Respiratory syncytial virus, also known as RSV, a comprehensive approach to identification, prevention, and treatment. Please take a moment to pause this video and access the pre-test, post-test link featured in the video description below before proceeding. The learning objectives for this course are as follows. By the end of the presentation, all participants will be able to define RSV, identify the population at risk for RSV, know how RSV is transmitted, recognize the signs and symptoms of RSV, explain the importance of prevention strategies, and describe treatment options for RSV. After program completion, all participants should be able to pass the post-test. Let's get started. What is RSV? According to the Center for Disease Control, respiratory syncytial virus, also known as RSV, is a respiratory virus that was discovered in 1956 and is known to infect the lungs, causing mild symptoms similar to the common cold or more severe ones like bronchiolitis and pneumonia. In technical terms, RSV causes increased mucus production and bronchial obstruction, which narrows the airways. RSV affects patients across the globe and results in 3.2 million hospitalizations and 59,000 deaths per year. By the age of 3, most children have already been infected by the respiratory syncytial virus. Which population is at risk for RSV? RSV is a prevalent issue because it infects patients of all ages, putting those with weakened immune systems at the most risk. RSV infections tend to be less severe in young and middle-aged adults, whereas approximately 11,000 elderly patients in the U.S. die from RSV infections each year. Those who are at the most risk for complications of RSV include premature babies, young children with heart or lung problems, the immunocompromised, and the elderly. How is RSV transmitted? RSV is spread through large droplets such as those from a cough, sneeze, or kiss, and contaminated surfaces such as a doorknob. Schools and daycares carry higher exposure rates as the virus can live on contaminated hard surfaces such as tables or toys for hours. Most people infected with RSV are contagious for 3 to 8 days. Those who are immunocompromised may be contagious for up to 28 days, even after symptoms resolve. Transmission trends vary each year and change regionally. However, in the United States, the time frame between fall and spring typically has the highest rates. What are the signs and symptoms? Symptoms of RSV typically appear 5 days after exposure. Initially, patients may complain of a runny nose and cough. If symptoms progress, the patient may notice an increase in the rate of breathing, noisy lungs, known as wheezing or crackles, and find it difficult to breathe. Other symptoms may include decreased appetite, sore throat, sneezing, and fevers. According to the Children's Healthcare of Atlanta, symptoms often last approximately a week. Can we prevent RSV with pharmaceuticals? Unfortunately, no approved vaccine for the prevention of RSV currently exists. In the 1960s, researchers pushed for the mass inoculation of young children and infants using a formalin inactivated RSV vaccine. The vaccine created an 80% increase in RSV hospitalizations among vaccinated children. As a result, there is a lot of hesitancy about diseases caused by RSV vaccines. Monoclonal antibodies were developed in the 1990s. Palivizumab was recently approved by the American Academy of Pediatrics as prophylactic treatment for high-risk children and infants who are deemed likely to benefit. Palivizumab is very expensive though, so it is often only prescribed to premature babies and children with chronic lung disease, congenital heart disease, neuromuscular disease, or immunodeficiencies. Once administered, palivizumab provides protection for 1 month. Therefore, monthly injections throughout RSV season are often required. Prevention steps to take at home. Washing your hands with soap and water or alcohol-based hand sanitizer for 20 seconds will help prevent the spread of RSV. Avoiding smoke exposure is also important because smoke increases complication risks associated with RSV, especially for children. Avoiding close contact with people who are sick will decrease the chance of catching RSV. This includes kissing and sharing utensils. Finally, cleaning soft and hard surfaces will remove contamination and further prevent the spread of RSV. What are the treatment options? Treatment for RSV is usually supportive, with an emphasis on comfort and hydration. If an infant is sick and cannot blow his or her nose, a bulb syringe may be used to clear the nasal passages. Pain and fever reducers can be used, but aspirin should not be administered to children. Remember, seek medical attention if the person with RSV exhibits signs of difficulty breathing or eating. If hospitalization is required, interventions may include supplemental oxygen, fluid administration, and/or suctioning as needed. The information in this health education program came from several resources, including the journal Human Vaccines and Immunotherapeutics, the Center for Disease Control and Prevention, Children's Healthcare of Atlanta, the journal The Nurse Practitioner, and the International Journal of Molecular Sciences. Thank you for your time. Please take a moment to pause this video once again and access the post-test and brochure below in the description. Thank you.